Is gene therapy safe for cystic fibrosis patients long-term? Gene therapy for cystic fibrosis is an exciting area of research with promising potential. However, the question of long-term safety remains a focus of ongoing studies. Early clinical trials have shown that gene therapy can improve lung function in patients and generally has minimal side effects. This is encouraging, but it is essential to understand the risks involved. One concern is insertional mutagenesis. This is when the therapeutic gene integrates into the host's DNA in a way that could potentially lead to cancer. Another issue is the possibility of immune responses against the therapy vector or the corrected cystic fibrosis transmembrane conductance regulator protein. Because of these risks, long-term monitoring of patients in clinical trials is crucial. The durability of the effects of gene therapy is also a significant topic. Airway epithelial cells, which are crucial for lung function, turn over relatively quickly. In mice, this turnover is estimated to happen every 11 days. This means that therapies targeting only the differentiated cells may need to be administered repeatedly, possibly on an annual basis. Researchers are working on more durable approaches that target basal cells, which could provide therapeutic effects lasting 5 to 10 years or even longer. Another challenge is the thick mucus that characterizes the lungs of cystic fibrosis patients. This mucus can hinder the delivery of gene therapy vectors, making it necessary to develop methods that can effectively penetrate this barrier and reach the airway cells. While gene therapy is still largely experimental for cystic fibrosis, it offers hope, especially for patients who do not respond well to current cystic fibrosis transmembrane conductance regulator modulator drugs. These modulators have shown long-term safety and efficacy in improving lung function and nutritional status. However, they do not benefit every patient due to genetic differences or intolerances. In summary, gene therapy for cystic fibrosis is progressing with promising early results. However, its long-term safety and effectiveness have not yet been fully established. Ongoing research and careful patient monitoring are essential before gene therapy can be considered a safe long-term treatment option. For now, established therapies like cystic fibrosis transmembrane conductance regulator modulators remains the standard of care. Gene therapy is viewed as a complementary strategy that needs to be tailored to each patient's unique genetic profile and disease characteristics. Always consult healthcare professionals for personalized medical advice.